I'm Dr. Erik St. Pierre. I'm the Emergency Department Director at Northern Maine Medical Center in Fort Kent, Maine. I was looking on YouTube yesterday and ways that you can possibly preserve PPEs and reuse them. And we've had a shortage of N95 masks, so we were trying to come up with ideas on how to reuse our N95s. So we had the idea of being able to use an N95 for a whole shift or, for multiple patients since we're running in short supply. One of the thoughts was to take your N95 off and then place it into a paper bag since plastic bags seem to harbor bacteria. So I was looking online and I saw that some people are now using food containers to basically be able to preserve their N95 and suspend it in air so they're not touching the front of the mask when they're putting it on. So unfortunately, working in the emergency department last night, I couldn't find any food containers. So I was trying to see, is there an alternative that we could possibly use that would work in this case? And I can kind of show you, because once I discovered this, I actually found that there's a way to store your N95 in this unit that I've created, and it doesn't touch the unit. It suspends it in air, and it keeps you completely protected from touching the mask when you're donning it and doffing it. So the thing that I was able to find is a small specimen hat that you use for collecting urine or stool. It's preferable if you use a new one rather than a used one. And you can take this here and you can make your own N95 holder. The only other piece of equipment that you need is a couple of push pins and a pair of trauma scissors. And I'll show you how this works. So the first thing is, I use this as a template. You kind of want to cut the wings off of the hat because otherwise it's too big. So what I've kind of done is just kind of work my way around like this. And then cut the wing on the other side so it matches fairly evenly. Now, the important part is to place notches so that you can suspend the mask appropriately. Now, I found these were sharp edges, so I'm going to blunt these edges. And this is the only part that became a little bit difficult, that you have to make sure you don't crack this as you're cutting it with the trauma shears. But you want to carefully just kind of cut through the plastic. And in this area where it bends, you want to be a little bit more careful. There you go, just like that. And do the same thing on the other side. And now your edges are much more blunted. And then I tried to figure out what the best position was to put the grooves, and found that the 11 o'clock, 1 o'clock, and then the 7 o'clock and the 5 o'clock position is probably the best place to put your grooves. So I will place these right here. So just cut some little triangular shaped grooves out of it right here. Another triangular shaped groove. Looks like this. Then at the top, same thing. Like this, and another one like this. Now that you have this looking like this, you now have your template to be able to build your mask. You take two colored push pins, whatever color you prefer. I think I will go with red. And we put one up at the top like this. Put that in, and take another push pin and put that on the bottom like this. And now you have now finished your PPE N95 holder. So we will remove this one off this, and I will show you how this works. So this is the first time that I'm using my N95 for my first patient, so I will put it on the proper way. Make sure that I grab it like this, put it on, put the bottom strap on first as they recommend, put the top strap on afterwards like this. Make sure the straps aren't crossed. Bend it in here. It's tight, it's sealed. Now, I go off to see my first patient. I come back, I want to remove my N95. This is now contaminated. So let me say that again. So now I've placed my N95 mask. This area is contaminated. So I take this, place this over my face like this. Bottom strap. Notice. Take the top strap. remove it, and there is your PPE completely suspended. I haven't touched anything on the outside. The only thing I've touched is my straps. So at this point, I would obviously clean my hands off. I would have done that first. Clean them off again. You can even, if you're concerned about having contaminated the straps that are in the back of your head, you can actually wipe these down with Clorox bleach solution or a wipe or something like that to kind of keep that. But you'll realize the inside of your mask at all times is protected. So now what I want to do is I go see my next patient. I can put it back on simply by grabbing this, which is completely sterile. Washing your hands, obviously, before you do this. Placing your mask back on. Always take your bottom strap. Come over the top of your head. Take the top strap off. Now you've done this. Wash your hands. Put on your gloves. Adjust your mask, which was contaminated before. Wash your hands again. Put on some gloves. And now you can go see your patient. So, part 2, if you want to make this a fun activity, grab yourself your Sharpie, put the name on the outside of your mask or your holder, like so. So you have St. Pierre right here. And then after that, depending on whether you're in a good mood or a bad mood, you can make yourself either a happy face or a sad face or whatever face you want. And then makes it kind of a nice project. So again, the nice thing about these, I'll put it back on one last time so you can see how we do this. You basically would have your mask that's on like this, or I'll take it off one last time. Put this back onto your face like this. Bottom strap. Top strap, and then you can just place it over here, and everybody can find an area where they can have their masks, which are there to dry. You can keep them organized. You don't have to be putting them in a paper bag somewhere when you need your mask. You go look it, here's your name, pick it up, and you can reuse it. Just an idea, just a thought. Total cost, probably under 10 cents. There may be a possibility that we may run out of these specimen collection hats, but hopefully not. And this gives you a chance to reuse your PPE, and I think personally one of the safest manners. My 2 cents. Feel free to use this as much as you want or share it. Thank you.